This lecture is going to go over lice. Starts on page 1185 of your textbook. If you see the term pediculosis, that should clue you into that we're talking about lice. Just like with tinea, pediculosis can have Latin words behind it that indicate where the infection is occurring. So pediculosis capitis would be head lice, and that's what our lecture is going to focus on. There's also pediculosis corporis, which is body lice, and then pediculosis pubis, which is pubic lice, also known as crabs. So what are lice? Lice are small blood-sucking insects, approximately 2 to 4 millimeters in length. Pediculosis refers to infestation of lice on the scalp or body. Although pediculosis is not a serious health concern, it can cause embarrassment and often elicits an emotional reaction among parents and school personnel who mistakenly associate it with poor hygiene. Under etiology, lice live only on humans and are transmitted by direct contact with infected persons or contact with infected objects such as brushes or hats. Lice cannot jump like fleas, and clean hair is no deterrent for head lice. Under manifestations, again, we're going to focus on head lice. And this picture here on your slide is a picture of nits that you can see attached to the hair shafts. So nits are visible and are attached firmly to hair shafts near the scalp normally. They are tiny, silvery or grayish white specks resembling dandruff. If you're looking at a child and trying to figure out if it's dandruff or a nit, you'll know it's a nit because they're very difficult to remove. You have to pull them along the length of the hair shaft. And it's almost like they're stuck or glued to the hair shaft. They're commonly found behind the ears and at the nape of the neck. The patient may also have scattered lesions on the scalp, behind the ears, or the back of the neck because of the intense pruritus caused by a lice infection. Secondary scalp infection can develop from scratching. For diagnosis, the diagnosis of head lice is made by identification of nits or lice on the scalp. Again, if you're doing a lice check, you want to pay particular attention to the crown, behind the ears, and the nape of the neck. And we already talked about, unlike dandruff, the nits are really stuck to that hair shaft and it can be difficult for them to get off. In terms of management, I want you to recognize the treatment permethrin 1%. It's an over-the-counter pediculicide, so a treatment that kills lice. It kills head lice and pubic lice and eggs with one application and has residual activity for 10 days. You want to make sure that the treatment is left on for about 10 minutes and that the hair isn't shampooed for 24 hours after treatment. Even though the kill rate's high, there's a residual action, and patients should treat the hair again after 7 to 10 days. So it's important to recognize that it's a two-phase treatment. Because of the lack of residual activity, treatment with these products must be repeated on 7 to 9 days after the initial treatment. Addressing the environment, so that's a big thing. We don't just want to worry about the patient's hair if they have head lice, because we also need to worry about the pillow where they've rested their head, their hat that's been in contact and may have a strand of a hair with a nit in it, toys, all that good stuff. So under addressing the environment, environmental objects such as clothing and bedding should be treated or washed. Family members also need to be checked out, anyone who has had close contact with the patient. Parents should notify the school if the child has an active case also. Meticulous vacuuming of carpets and classrooms with affected children will help to prevent the transmission. You have a purple nursing care box for the child with pediculosis on 1187. Go ahead and look that over and pull out some important stuff under interventions. Advise caregivers to carefully follow directions that come with over-the-counter pediculicides or to follow physician's instructions using a prescription product. Reassure parents that lice infection does not reflect poor hygiene or low socioeconomic status. Removing nits can be done by backcombing with a fine-tooth comb. Nits can be loosened with a mixture of half vinegar, half water. If the child, it is easier to remove nits if the child's hair is damp rather than wet or dry. Advise the parents to wash clothing, especially hats and jackets, bed linens, any sort of bedding, blankets in hot water, and then to dry them in a hot dryer setting. Dress up clothes, hair ornaments, bicycle helmets, batting helmets, headphones, anything like that should also be treated. Any items that cannot be washed or dry cleaned should be sealed in a plastic bag for 2 to 3 weeks. Caregivers should be encouraged to vacuum off floors and play areas and furniture to remove any hairs that may have live nits. Combs and brushes should be boiled or soaked in anti-lice shampoo or hot water for at least 10 minutes. Routinely teach children not to share hats, combs, or hair ornaments with other children. The child should be rechecked for an infestation in 7 to 9 days. Advise caregiver to call the physician if itching interferes with child's sleep or if the condition does not clear up after a week or after the 2 treatments that the child gets. You were assigned to do case study 123, which is about head lice, and we will review that together in class.